Good evening and welcome to our 2020 membership meeting. I think I speak for everyone when I say that we wish this were live, but it is what it is. Our meeting is called to order. I'd like to thank all of our 2020 annual sponsors. Thank you for your support, which allows us to serve our physicians throughout the year, especially this year. I'd like to introduce our 2020 annual membership meeting presenting sponsors to share a few words. Dr. Pam Hudson from Crestwood Medical Center.
Good evening. Crestwood is grateful for our relationship with the Madison County Medical Society and is looking forward to many more annual meetings, more normal than these Zoom meetings. Mostly, however, I am grateful to have the opportunity to thank you all, our community physicians, who are also largely independent businesswomen and men. You have responded so positively to both the clinical and the business challenges of 2020's COVID pandemic. I've had the occasion to have been in 40 or so private practices in the last couple of weeks. How different to see empty waiting rooms, patients waiting in their cars, everyone wearing masks, all consistent and clear support of the public health measures. Now we have two more weapons: the monoclonal antibody, now called BMAB, and the vaccine. It's been my privilege to represent the Madison County Medical Society and all the physicians at the emergency management level this summer and fall, while our colleague Norman Savio was serving our country deployed. Thank you for all you do for patients. Thank you for your flexibility as we continue to navigate this pandemic, and thank you for your support of all healthcare workers in our community. Thank you for being heroes this year. Happy holidays.
ProAssurance, Robin Beasley.
Good evening, Madison County Medical Society. Robin Beasley with ProAssurance here. Do not be alarmed. That is not the very hungry caterpillar crawling across the screen of your device on my face. That's a good old-fashioned mustache that I grew back in the spring during full quarantine and lockdown, and I just can't seem to let it go. It is ProAssurance's privilege and honor to be one of the sponsors for your annual meeting tonight. It's ProAssurance's privilege and honor just to be able to support the Madison County Medical Society in general. You guys just do incredible work there in the greater Huntsville area. The physician engagement, the involvement, the outreach is all just really, really impressive. And like I said, it's just our privilege to be a small part of it. Many of you probably know now that Austin Snow and Tom Phelps retired from ProAssurance earlier this year. Tom retired at the end of April and Austin retired at the end of August. We already missed those guys around here. I know y'all missed them as well. With their retirements, I will sort of become the new face of ProAssurance, I guess, there in North Alabama and in the Huntsville area. So I look forward to getting to meet all of you and getting to know you better. Hopefully very soon we can be doing these things in person again. I know the Medical Association is scheduled to have their annual session there in Huntsville in April, and maybe, just maybe, we'll be able to do that. And if we are, I look forward to seeing all the good folks from the Madison County Medical Society there at the annual session in April. And I promise if we are able to do that in person, I'll shave this mustache before that meeting. In the meantime, thanks again for allowing us to be part of what you do. Everyone have a safe and happy holiday season and a happy new year, and we hope to see everyone soon. Thanks again.
Progress Bank and Progress Financial Services, Clint Kirkland.
Hey, good evening. Progress Bank and Progress Financial Services are happy to once again have the opportunity to be a host and sponsor of tonight's holiday cheer event. My name's Clint Kirkland, and I work with our professional and healthcare banking group. I hate that we're not all able to be together to enjoy the holiday cheer party as in past years, but with the pandemic and everything going on in 2020, just trying to be smart and do what feels best, but still be able to have this event for you tonight. You know, supporting our medical community's needs isn't something new to Progress Bank. We were formed back in 2008, and we're the only locally owned and operated bank in Huntsville, Madison County. And because of our responsiveness and personal touch, we were able to quickly get emergency PPP funds to so many small businesses and practices in the area. Knowing your customer these days is even more important than it ever has been because of all the struggles that we're going through. We at Progress Bank and Progress Financial Services are here and want to be here to support our local community's financial needs. So again, hey, we're not all together tonight to enjoy this holiday season together, but hopefully next year. But again, thank you, stay safe, and enjoy your holidays.
I'd also like to thank our partners, the Madison County Medical Alliance and the Medical Association of the State of Alabama. So much of what we are able to accomplish is because of the support of these organizations. Over the past 3 years, we've created a very robust wellness program in an effort to care for our community's physicians. We're all aware that medical health professionals are at high risk for burnout. We provide confidential counseling and host wellness events. In February, we had a delightful event at Campus 805 where many of us gathered and were entertained as well as had a learning experience. Just last month, we had a hiking event on Montesano that was a lot of fun too. We'd like to thank all of our generous physician wellness sponsors for their support, with a special thanks to Huntsville Hospital, the Medical Association of the State of Alabama, and ProAssurance, who each made 3-year commitments to this cause. We'd also like to thank Service Bank, the Madison County Medical Alliance, and Crestwood Medical Center for their contributions. I'd like to introduce tonight's keynote speaker, Dr. Scott Harris, ADPH State Health Officer. Dr. Harris is North Alabama's own, and he's made us proud. He has provided strong, consistent leadership through these treacherous waters. We appreciate the leadership and are honored to welcome him to share his thoughts this evening.
Hello, everyone. Thanks so much for letting me join you today. I'm Scott Harris at ADPH in Montgomery, and I really appreciate the opportunity to be with you today. I appreciate being recognized by this group. Madison County has always meant a whole lot to me. As you know, I've spent most of my professional career in North Alabama, living in Decatur and practicing medicine there for about 20 years, but also working for public health in a number of North Alabama counties, including there in Madison County as well. Huntsville is a town I know really well and really appreciate. And I also really appreciate just getting to speak with you. I know I've talked to a lot of you individually over the past several months as we've been going through this COVID response. It's been really something unprecedented and something that I was certainly not expecting to do when I came into this job. I'm sure most of you weren't expecting this either, but you know, it's hard to believe, but the very first recognition that we had an outbreak anywhere in the world actually was the week before Christmas, just this past year. December 21st of 2019 was the first public recognition in China that there was an outbreak of this disease in Hubei province around the city of Wuhan. From that, which most of us probably didn't even notice on the news, we've gotten to this point where it seems to consume most of our professional lives and personal lives too, for that matter. The first case we had in Alabama, you may recall, was on March the 13th. It was a Friday the 13th. In fact, it's been Friday the 13th ever since then, I believe. But from that first case that we saw in March, we now have over 250,000 Alabamians who've been infected. If you follow the numbers on our dashboard, you can see that we're north of 260,000 cases so far. Those are not positive test results. Those are numbers of individual Alabamians, unique people who've been infected. So over 5% of our state population has been infected, and that's just what we know about. We think there are probably others that we're not aware of. It's unfortunate, but the entire country is now seeing a surge unlike we have ever seen before. You know, we remember how terrible those stories looked in New York City, which seems a long time ago and a long way from here. And now, unfortunately, that's being replicated everywhere in the country. With 13 or 14 million total patients who've been infected since February in our country, we're now at a rate of adding about 1 million patients per week. Okay, so we had about 10 million in the first 7 months or so, 7, 8 months. Now we're adding about 1 million patients a week across the country. So this is an unbelievable thing that we're experiencing. Our hospitalization numbers in Alabama, I'm sorry to say, this week have reached an all-time high, and not just by a little bit, but in fact, we have more than 100 patients more in the hospital this week as inpatients than we saw at our previous peak back in July. More than 1,700 Alabamians were hospitalized as of yesterday, the day before I'm filming this for you today. So we don't think that Christmas is gonna be that happy a time, unfortunately. We have been seeing a surge throughout the end of October and 1st of November anyway. The Thanksgiving holiday gives us a lot of trepidation. We certainly saw evidence that a lot of people were traveling, a lot of people were getting together. We hope they were doing it safely. But you know, experience has taught us that holidays have been pretty cruel to us. So we would like to think that there's some good news on the horizon, and in a sense there is. We do believe that we're going to have vaccines approved for us very soon. The first vaccine is expected to be the Pfizer vaccine. As you know, that's undergoing review for an emergency use authorization by FDA right now. If things go exactly as planned, we believe we can have that vaccine here in Alabama around December 14th or December 15th. It won't be quite ready to give because there's still some independent review that goes on by the Advisory Committee on Immunization Practice. But probably by the second to third week, full week of December, we may be ready to start distributing vaccine. And that's going to help a few people at first, but not a lot, because we're just not going to have a lot to give, unfortunately. We want to manage people's expectations and say that even though the vaccine is here, it's going to be a few months until it's widely available for most people, even though a lot of healthcare workers like you on this call today are going to have access to it as soon as we can, but there will not even be enough for your profession for the next several weeks. So what that means is that we want the public to realize that just because they see someone getting a shot on TV later this month, it's not time to give up everything we've been doing. We have worked really hard to communicate to the public the importance of wearing masks, the importance of staying home when you can, or staying 6 feet away from people if you can't stay home, particularly the importance of staying home if you're sick and seeking medical care if you're sick. Those are really all the tools we need to put an end to the pandemic, if we can only get people to do that. But, you know, changing human behavior is really, really hard to do. Even, you know, if you're trying to get people to exercise or trying to get people to eat less or trying to get people to wear a mask, all those things are really hard. We don't like being told what to do, and we don't like changing our lifetime's worth of habits. But that's really the mission that we have, is trying to help people understand what's really best for them and what's best for our community. And so I appreciate so much the help that I've gotten from you all. Your medical society in Madison County, through your Board of Health, has been a tremendous advocate for doing the right thing. And I really sincerely appreciate that. I know many of you that I've talked to personally about the mask mandate, for example. We appreciate the leadership that your county showed in getting that enacted even before the governor had a statewide mask mandate. So again, we just appreciate so much all you're doing. We still have a long way to go, but we do have some hope on the horizon. I really appreciate the chance to join you again today, and hope I can see you again in person once we can get through these COVID times. Thank you for having me.
Dr. Harris, in response to the COVID-19 global pandemic, we present you with this award. We can't thank you enough for all that you've done for Alabama. We'd like to honor you for the outstanding contribution to medicine. I also had the honor of presenting this award to Dr. Karen Landers. She's bold and opinionated and a force to be reckoned with. This is why she's good at her job. We're grateful for her devotion to public health and appreciate all of her hard work. We would like to recognize two long-term friends of the Madison County Medical Society from ProAssurance, who transitioned into retirement this year. Tom Phelps and Austin Snow have both been part of ProAssurance for over 35 years. Their support of organized medicine, and especially of the Madison County Medical Society, has enabled us to thrive. Tom retired at the end of April, and Austin retired at the end of August. They were universally respected and liked by all who worked with them. Both will be missed. We always enjoyed having them at our events and they made our Washington, D.C. trip especially special. We wish them well in retirement. In response to the COVID-19 global pandemic, we presented the following recipients the John Higginbotham Outstanding Contribution to the Community Award. Mayor Tommy Battle has provided strong leadership since the very beginning of this pandemic. He has had the foresight to organize leadership in our region and present a united force. This group has worked together to strategize and educate the community throughout this entire ordeal. Madison Mayor Paul Finley has also been instrumental in these efforts. County Commission Chairman Dale Strong has been a staunch advocate for a safe community. He serves on our County Board of Health. David Spillers has been the voice of North Alabama's medical community. He's provided strong leadership and with his team has worked hard to provide resources such as testing and PPE. He has been a voice of reason and we've appreciated his leadership. Jeff Sams and his team have worked tirelessly to assure preparedness. The devil is always in the details, and he's done an amazing job of working to keep all of this afloat. Dr. Pam Hudson has overseen Crestwood's response and has been a part of the information team and panel as well. Jeff Birdwell, Huntsville-Madison County Emergency Management Agency Director, has demonstrated the necessity for coordination of emergency management efforts.
We'd also like to thank former astronaut Jan Davis for being the face of our masking initiative. Dr. Davis was kind enough to take time out of her schedule to film Mask Up Madison County public service announcements, and she agreed to appear on billboards and in social media across our county. Thank you so much, Dr. Jan Davis.
Destin Sandlin is an engineer. You may know him from his Smarter Everyday videos that are absolutely delightful and fun on his YouTube channel. He led the Huntsville Fighting COVID initiative, coordinating local and statewide efforts to supply 3D printed face shields to frontline workers. Jennifer McCollum works on Redstone Arsenal and oversaw the logistics for the face shield distribution. This was quite an undertaking. Carson Davis works at NASA and helped to print the 3D face shields, created the website, and handled the communications and logistics for Huntsville Fighting COVID. Thank you to all of our award recipients, trustees. You've served during an awkward and difficult time, and I appreciate all of your help. I'd also like to say a special thanks to our staff. We have an amazing team. They work hard to keep us going, and they make us look good. And finally, my last official duty as president, the passing of the presidential gavel to Dr. Aruna Arora. I want to thank you all for the opportunity to serve as the president of the Madison County Medical Society in 2020. Even though it's been an interesting year, I have really appreciated the chance to serve. It's been an interesting time in many, many ways. Some of the highlights early on, while things were still normal, I went on the Washington, D.C. trip with NASA. That was an interesting opportunity and a lot of fun as always. I think that accomplishes a lot of things. Talking with our leaders and hearing what's going on in Washington is always fascinating. And then we had an amazing wellness event. Our wellness effort is something that our society should be very proud of. And our event this year at Campus 805 was a huge success. Then things changed and we weren't able to have as much actual getting together and ability to socialize and work together in person, but we still accomplished a lot. And I'm very proud of the fact that in this COVID epidemic, we were instrumental in forging ahead with a masking rule ahead of the rest of the state. And we've been on one page pretty much in this whole thing, trying to help the medical community as well as our patients and community get through this. We've met a lot of interesting people and had a lot of help along the way, and we're indebted to all of those. Going forward, we all hope that this horrible pandemic ends soon. Not soon enough for any of us, I'm sure, but things are changing, and hopefully things are looking up in the near future. Aruna, I wish you all the luck in the world. I honestly can't imagine being in charge of the state association and our county organization at the same time, but you'll do a good job. Going forward, I would emphasize that the Madison County Medical Society exists to better the medical community and emphasize that we are a medical community, and we need to keep our medical community strong and thriving even in these difficult times. So I wish you all the success in the world, and I'm sure you'll do an amazing job.
Thank you for joining us tonight and being part of our Madison County Medical Society. I want to thank Dr. Squires, Laura, Robin, Sarah Beth, Dr. Smulligan, Dr. Parks, Dr. Tabarrow, and the entire 2020 Board of Trustees. We were able to work together and do great things this year. I am honored and excited to serve as our Madison County Medical Society president for this upcoming 2021 year. Many of you may agree with me that 2020 was the toughest year in recent memory. It tested our strength as a society that prides itself on developing a culture and atmosphere that encourages bonds between and among physicians, young and seasoned. This 2020 year has brought unprecedented Zoom meetings, virtual conferences, and of course, telemedicine in all shapes and forms. Through advocacy of organized medicine at the local and state levels, we were able to make changes in telemedicine reimbursement, liability protection to prevent lawsuits as an executive order. We have also shared many phone calls during the immediate crisis with our beloved State Health Officer, Dr. Scott Harris. We have also had how-to sessions for small business loans and stimulus funds. We were able to work together to help advance access to PPE for our members in our community, a direct benefit many of you have appreciated with such gratitude to have received. We did this while also providing resources to physicians that promotes an environment that both reduces and treats physician burnout. We are very much looking forward to some more virtual group sessions, outdoor small gatherings, as well as our upcoming mindfulness stress-based reduction course at the start of the new year with Leela Neighbors. Our goal for the next year will continue to build on the relations and bonds we share by establishing a mentorship program for new and young physicians. I remember how much I appreciated guidance from more experienced physicians when we first started our practice. We hope to formalize this process to those interested, in particular those physicians that are underrepresented minorities, rural physicians, as well as female physicians. This is a year to strive for higher goals of inclusivity and engagement. Please help us by reaching out to any non-members throughout the community that may be interested in joining our Madison County Medical Society. I am always available for questions and concerns. We look forward to being of service to you this year. The meeting is now adjourned. Please enjoy your evening and have a wonderful holiday season. But don't forget to join us for our Zoom link bingo games because there are some really fantastic prizes. Thank you.
"2020 has been an extremely trying year for everyone, but especially for those in healthcare. We hope that you and your family have all stayed safe and healthy. You can see I am currently quarantined at home with a 9-month-old and a 3-year-old. We're all just learning how to get by. Here at the Medical Association in the state of Alabama, we have done our best to help equip you during this strenuous time. Starting in March, we began sending out daily email updates to all physicians, regardless of membership status. We hosted several statewide phone calls with State Health Officer Dr. Scott Harris so that physicians could get firsthand information and ask questions about the pandemic. We initiated a campaign that allowed physicians to order much needed PPE We helped draft the executive order that limited physician liability during the pandemic, and we were instrumental in getting the funds secured for physicians to apply for the state COVID-19 healthcare grant from the CARES Act funds. We will continue to be here fighting alongside our physicians through the pandemic and what may come after. If there's anything we can do to help you, please reach out to us. Thank you. We hope you have a very happy holiday season, and we look forward to seeing you in 2021. Wasn't nice?
Hi, I'm Frances McCarty, and I'm president of the Madison County Medical Alliance this year. This year, the Alliance for On-Call decided to go virtual since obviously it was not safe to meet in person. We asked our sponsors and our advertisers to join with us as we did an electronic on-call, which means that we send out emails twice a week featuring our sponsors with a special video from them or a message, and followed by one of our community organizations that we support, a message from them, and then we introduce the doctors in different tranches with each email. So about 10 emails went out throughout the month of August, and we were very proud of what we were able to accomplish because we did it all by ourselves. We had no expenses. We were able to guarantee that every dollar raised is going to go out to the community organizations that we support. In fact, in a couple of weeks, we'll be voting on who receives that money to go out for Christmas coffee. We were able to raise about $23,000 or over $23,000, and we're very proud of the success we saw, especially during this time. Finally, what the Alliance is looking forward to next year is a stronger and better membership, and with communications that are going to be improved. You'll see changes coming this spring about our email system, and hopefully being able to reach a lot more people than we've been able to the last couple of years. But also we're focusing on a membership drive, so more to come on that information, with a special membership rate focused through April 2022 of next year. Lastly, we are putting in place a liaison committee, if you will, where we are focusing on trying to have somebody from each group of the Madison County areas, have a alliance person involved in each one of those doctor groups to invite the new people that might come into the community, but also let everybody in their group know of, hey, the Alliance is doing a meeting this month. Would you like to go with me or meet me there? Or just heads up in case you haven't been able to get their emails. So next year we're working on having a much better communication to our group and recruiting more members.